medical advancements and social security has imparted longevity to the population. With the extending longevity, aging population is on a rise. Keeping this in mind, Indomedicon held its 6th Anti-Aging Medicines and Research Conference from 15 to 17 January 2016 at Seven Hills Hospital, Mumbai. The motto of this event was, "Stay healthy, stay young."
We are here to actually help people stay healthy, stay young, and improve the quality of life. We started this mission somewhere back in 2008, and since then we have seen extreme growth. This conference has been an eye-opener for us, because in this conference we found so many speakers who have given their insight on things that we were not even aware of, and we are thankful for them to bringing up here.
With the understanding of the need of anti-aging medicines, the event organizer spoke about its reach and the reasons on why anti-aging has become so important.
The motto behind conducting this conference is reach to every doctor with the concept of anti-aging. What is anti-aging? It is our approach where we try to approach a human body with a holistic, not focusing on a particular disease, but making his life better, adding more life to his years. That's what our concept is.
During this 3-day event, there were various professionals from different disciplines of medicine who spoke on topics such as diabetes, obesity, hormonal diseases, osteoporosis, cancer, etc.
Looking good and longevity may not come together. A bit of being overweight prevents you from osteoporosis. A bit of being overweight delays your menopause. A bit of being overweight makes your body more resistant to the acute insult coming to you. So pharmaceutical intervention to delay aging can happen. We always keep on talking about diet, exercise, healthy lifestyle, good sleep, blah, 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 so many things, which patient is doing basically. We are just telling the patient to do. So being a doctor, we have to do something different. And what's that? The pharma intervention. But how will pharma work? Till they don't know this concept. So they are working on it.
Inflammation proceeds and it can give rise to cancer if it is left out without control. And that is where the research is going on. Now, of course, there is an individual variability within the population and different range of aging in different individuals. But these are the markers which will guide us to tell whether a person is aging faster or not.
Prevention, of course, is the key to any elimination of disease, and in cardiovascular disease, because the disease starts very early, it should start very early in life. So adherence to lifestyle improves by telling the patients or showing them that there is disease in the artery.
The therapeutic principle of HBOD is increasing the partial pressure of the oxygen in the tissues of the body. The oxygen needs a RBC as a vehicle. RBC is a must. With hyperbaric oxygen, we can change the rules. We can use plasma as an oxygen carrier. We can use CSF as a plasma thing. Even the lymphatics.
Science is a logical study of the mechanisms which can be repeated at any place, at any time, with 5 senses. Our modern science nowadays believes that 6th sense may be in hypothalamus or limbic system, but still we are not able to make out where it is.
The brain consumes same amount of calories as of your muscle, 2,500 calories every day. So the muscle at 2,500 calories and brain 2,500 calories. Brain is only 3% of your body weight and muscles are 40% of your body weight.
So when we're talking of what causes aging, what causes us to die, there are so many views and all they are the valid views. We cannot deny any of them, including the spiritual view.
With use or abuse of these drugs come with the risk of addiction. These drugs basically enhance focus and concentration, but also cognition, motor skills and attention in many patients. most of them are now being abused by students. You want to appear for an exam, you want to go for a 10th standard, a 12th standard, a CET competitive exam, you try and take mood stimulators. You want to stay awake the whole night, you take medicines which are high in caffeine, like Red Bull, and you tend to stay awake throughout the night. It's being used for military. It's used in management rooms.
7.7 million new cases of dementia come up every year, which is really a huge number and therefore a mammoth task in front of all the clinicians who have to manage these patients, and therefore comes the need as to whether we can prevent it and whether we can cure it.
So the science acceptance is evolving, the magnitude is growing, and still I see that morbidly obese patients, by definition, even by the American definition, BMI more than 40, being treated by simple medical treatment or lifestyle treatment with wishful expectancy, even by clinicians.
Nowadays, in evolution of the diseases, the disease pattern is changing. Not only the disease like cancer and this tuberculosis and this polio, and these are lost. Now we are advanced. As we are advancing, our priority is changing. Now our priority is to become a good one. We want to be in a quality life. In that quality, what will happen? The surrounding is affected by the addiction, smoking, drinking, alcohol, stress, and that is causing you dysfunction.
Typically, we are looking at a surgical procedure, that is what is called as a liposuction, where we are removing the fat which is lying in the superficial or a deep fascia, but typically above the muscles.
Scalp itching and burning has very important role because the changes in the scalp symptoms are actually a predictors for the flare-up. So never neglect those patients' complaint, because I remember if the patient comes to you, they're burning in the scalp, we said nothing, it will go. But it is not. It is a sign of a predict of a flare-up of a disease or the hair fall, you would get it. Or they are the markers where you will be able to predict the response to your therapy.
Anti-aging, they say, is no more restricted to outer looks and aesthetics. The aura of anti-aging practice has already surpassed all boundaries of medical practices.
External counterpulsation and chelation therapy. These are two modalities which are very good for heart patients and as anti-aging. Both of these treatments are non-invasive, and we introduced them in the country way back in the 1990s.
घुटनों के दर्द से कैसे छुटकारा पाना, और वो भी बिना सर्जरी, बिना ऑपरेशन के। जो नई नई मॉडलिटीज़ आई हुई है, जहाँ पर हम पहले ही बीमारी आने के कुछ साल पहले ही पकड़ लेते हैं उसको और उनको सही इलाज देके आगे खराब होने से रोकते हैं।
I spoke on anti-aging diets, where I gave more importance to the foods which we actually should be consuming, but priority to understand is the environmental factors which actually are causing a lot of anti-aging effect in us.
Now the time has come when anti-aging is a necessity, and as all of you all know that anti-aging is not really reverting you back and making a 50-year-old look 20-year-old, but it only involves making a person feel and look their best.
I was here today at Indomedicon to demonstrate the newest technology for anti-aging for skin called HIFU.
Acne today is probably very largely related to our diet and lifestyle factors, where there's a lot of consumption of processed food which is very high in high glycemic index foods, like a lot of sugar containing foods.
As you know, that obesity is a very common problem in our country, and it's going in epidemic proportion. So the basic thing is you have to create more awareness in obesity and how you can effectively control it.
I spoke on diabetes, how diabetes can be cured or eliminated from the root using stem cells.
At this anti-aging conference, stem cell therapy has a very important role to play. Stem cell therapy is a safe treatment, and it is an idea whose time has come, and it is something which is going to be used in the future more actively and aggressively.
I had the opportunity to discuss about liver and aging. Its role, does it actually happen? And what is the role of screening and supplements to prevent aging in the liver?
When we talk of hypothyroidism, it's either an overt hypothyroidism or it is a subclinical state.
The understanding of medical anti-aging has developed a new horizon for the medical practitioners.
Anti-aging medicine in Malaysia is already established for the last 14 years, and I'm one of the first board-certified anti-aging physician in Malaysia. So I believe that India will have a very good center or school or lecturers or scientists that we can work together to learn more about anti-aging.
Anti-aging medicine is something which is actually, we are talking about a new medicine, something which is, we are going ahead in technology. This conference shows all the problems of aging and how we can tackle it, how we can improve the quality of life of people who are aged above 50 years.
I came to know that every time I am learning a new subject, a new aspect of anti-aging.
I would really like to thank the organizer of this conference for organizing such a good conference for us to learn new things, especially in the anti-aging fields.
I learned a lot from the anti-aging, especially on the hormone, and also from other disciplines of medicines.
I would like to say that I really learned a lot from Indomedicon. It's an all-in-one thing and it's wonderful to be here.
In conclusion, certificate of participation were awarded to delegates. With a positive message of stay healthy, stay young, this 3-day conference successfully concluded.